Good morning. Welcome back to the OHSU Effect Inside Health and Science. I'm Lacey Evans, and we're continuing our conversation about personalized cancer medicine, this time with social worker Carrie Weymouth. She works on the breast cancer team at the OHSU Knight Cancer Institute. Good morning.
Good morning.
So the goal of personalized cancer medicine is to treat the individual in the manner that suits all their needs. And we're not just talking the biological side. So how is OHSU personalizing care to fit an individual patient's emotional and lifestyle needs?
Well, very excitingly, we've recently developed a whole department called Patient and Family Services, under which we're really developing programming that's really suited to people's individual preferences. So providing a variety of options for people, such as mindfulness-based stress reduction classes, our yoga classes. We have free yoga classes right now for our female patients, but we're also looking to develop classes for our male patients as well, because this is what patients are telling us that they want for their emotional and psychosocial support as they're going through treatment and even after treatment as well. And then we have things like writing classes, your more general kind of support groups, but more and more people are saying they want something more than your typical cancer support group. So we're looking at developing models based and programs based on what patients are telling us they want. And also we provide, as social workers, we provide counseling in the clinic, and also we're very connected with providers in the community who offer psychotherapy services tailored to oncology patients.
Do you kind of act as a liaison, if you will, between the oncologist and the patient?
We work very much as a team with the oncologist and with the nurse coordinators as well. And we're all really tuned into people's sort of psycho-emotional state as they're moving through treatment. And it's wonderful when we as social workers can kind of meet people at the beginning of their journey and walk with them. And because people's desires for support, it kind of shifts as they're moving through treatment. So what they might want or need in the beginning, it's often not clear. They don't know what they need. They're just so overwhelmed. And then in the middle of treatment, and then with a lot of the breast cancer patients that I work with, it's usually at the end of treatment that they feel that they have some emotional energy to actually start really tuning into where they're at in their sort of emotional and mental process, and they're ready to start processing the experience and looking for supports to help them with that.
So is there help for patients who are, it sounds like there is, who are having problems emotionally, maybe suffering from depression?
Absolutely. Many times the oncologist will address that if people are interested in medication to assist them with that aspect of their journey. And then the social workers, we meet with people and really attend to what it is that they need. For some people, things like the mindfulness-based stress reduction, that is a research-backed program that shows to really assist people dealing with very common issues like depression and anxiety. We see that so often in our patient population. So that's something that a lot of people, we refer them to. But then also just sometimes having a one-on-one meeting with one of us or someone in the community. And oftentimes it's meeting with someone that's not a family member or a friend, sometimes having that contained space with someone who's not emotionally invested in their process can be very freeing for people. So they find that really helpful. And research shows, too, that that also is really helpful.
What about after treatment? Do you still offer support programs during that process?
So we do. I have a lot of breast patients that I meet with even months after they're through with treatment, because many times, as I said, that's often a really difficult time for people. They're surprised. They're so excited to be through with treatment, but it's often an emotionally challenging time for people. And we're actually in the process of developing our survivorship programming. There's really an imperative among cancer centers nationally to really develop strong survivorship programming for people, because we realize that the journey doesn't end when treatment ends, that there are so many unanswered questions and education that people need and support that they need to move forward with their lives.
What about a cancer patient's family and also possibly a cancer survivor's, family? Do you help them at all?
We do, absolutely. I am in contact with a lot of our breast patients with their husbands, and getting them connected. We don't have a whole lot of formal programming for them. It's often more informal, like meeting with a social worker or getting them connected with a mental health provider in the community for that kind of support. Sometimes, things will organically arise where there's a match between a couple of husbands who, they're wanting to meet other men whose wives are going through treatment, and we can make that connection. But we're very available to talk with them and support them, because cancer is not an individual experience. It really impacts the whole family. So it's very important that we're attuned to how the family is doing and not just the patient.
And that's kind of where this personalized cancer treatment comes in.
Absolutely.
And I imagine that since you work with breast cancer patients, that appearance is probably a big thing you deal with.
Absolutely.
Talk about that.
Well, I work with a lot of women who do deal with the impact of having the surgery. So that's a very overt kind of change in a woman's body, whether it be a lumpectomy or a mastectomy. And I work with a lot of women who post-surgery, they can be very surprised. They feel that they're braced and prepared for what to expect after they wake up from surgery. And for a lot of women, it can be a little bit shocking. And there's really a grieving process in terms of losing that part of their body and trying to find ways to really make friends with this new body and find ways of finding comfort and intimacy with their partners. And it can be very challenging. And then especially too, many women are really challenged with the loss of hair. And so I talk with a lot of women about finding ways of taking control of the situation. There's a lot of women who will have, hair shaving parties or, go with their family and everybody gets their head shaved. And so just trying to take some sort of control of the situation as much as possible. But again, it's often a grieving process when they have to say goodbye to that part of themselves, even if just temporarily with the hair loss. But,
sure, absolutely.
Yeah.
So it sounds like this type of program is ever changing. So where do you see it going in the future? What do you see happening?
Well, that's a great question. I think the wave right now is really on survivorship. So I see us really focusing programs and having programs tailored, whether it be just specific survivorship support programs, like whether it be support groups, psychoeducational groups as well, and meetings with nurse practitioners and oncologists who are focused with how to manage their care post-treatment. I think that that's going to be a really important part of it. And then also just emphasizing and promoting these programs to people post-treatment and educating them about the importance of seeking that support when they're done with treatment and normalizing for them that it's okay to not feel done with treatment when treatment's done and that the journey really does continue. So hopefully at OHSU and the Knight Cancer Institute, we're really looking at just creating robust programming for all of our patient populations. There's a lot of programs for our breast cancer patients and for the prostate patients as well. So just really looking to expand that and really draw in as many patients as possible who might really thrive with that kind of support.
And if you want to learn more about the Knight Cancer Institute, on Thursday, this coming Thursday, June 7th, 7 p.m., there will be a half-hour documentary on the OHSU Knight Cancer Institute and its pioneering role in personalized cancer medicine. That's going to be on Coin, Channel 6, again at 7 p.m. Several medical leaders from the Knight Cancer Institute will be there, and they'll also be available on the phone to answer any questions that you might have. Carrie Weymouth, thank you for being here.
Thank you so much.